So what is hepatitis? Hepatitis is the inflammation of the liver caused by a virus, bacteria, or exposure to medications or hepatotoxins. As you can see, there is a clear difference between a healthy liver and an inflamed liver. Functions of the liver include glucose, protein, and fat metabolism, ammonia conversion, vitamin and iron storage, bile formation and excretion, and drug metabolism. The liver removes toxins, combats infections, and plays a key role in metabolic processes. When inflamed, it does not perform well. Here we have the liver. The liver is located in the right upper abdominal quadrant. It is one of the heaviest and largest organs in the body, weighing about 3 pounds. It is very vascular and it receives oxygenated blood from the hepatic artery and nutrient-rich blood from the hepatic vein. We will be talking about viral hepatitis, a systemic viral infection in which necrosis and inflammation of the liver produce a characteristic cluster of clinical, biochemical, and cellular changes. Hepatitis can be acute or chronic. In acute hepatitis, the body is able to fight off the infection. It can last less than 6 months and is usually caused by hepatitis A and E viruses. The symptoms are nonspecific and many patients can be asymptomatic. In chronic hepatitis, the inflammation of the liver is ongoing, so patients need medical treatment to stop further damage. It can last more than 6 months, and it is usually caused by hepatitis B, C, and D viruses. If it is left untreated, it can lead to cirrhosis, liver failure, or liver cancer.
Sudden and severe liver damage in a previously healthy patient is termed fulminant hepatic failure. While the hepatic lesion may be reversible with treatment, special care must be taken in cases where the infection progresses to encephalopathy. When fluids thicken due to inflammation at the bile ducts in response to a liver infection, tissue responds by generating an overgrowth of new disconnected bile channels and scar tissue, leading to cirrhosis.
There are 5 types of hepatitis we are going to talk about. Hepatitis A, infectious disease. Hepatitis B, serum hepatitis. Hepatitis C, non-A, non-B. Hepatitis D, Delta virus. Hepatitis E, similar to type A. The most common are A, B, and C. Next, there are 3 stages to viral hepatitis. Stage 1, pre-icteric stage. Stage 2, icteric stage. And stage 3, post-icteric stage. The pre-icteric stage can last up to 21 days. The symptoms will be flu-like. One will feel fatigued, have anorexia, nausea, vomiting, or diarrhea. There will be generalized pain, maybe some in the right upper quadrant, meaning inflammation of the liver. Bilirubin and enzyme levels will be elevated. The icteric phase can last from 2 to 6 weeks. Signs and symptoms include jaundice. The liver will be tender and enlarged. Dark-colored urine, clay-colored stools, itchiness, and there will be a decrease of the pre-icteric phase symptoms. The last stage is the post-icteric. It lasts 2 to 12 weeks. Here, jaundice will decrease, color of urine and stool return to normal, energy increases, pain subsides, GI symptoms will decrease or subside, bilirubin and enzyme levels return to normal. Hepatitis A virus is known as the infectious disease transmitted through the fecal-oral route. It is usually acute and can become fulminant. Risk factors include contaminated food and water, poor hygiene, sexual activity, especially those with oral-anal contact, crowded areas, drug use, and traveling to areas of high prevalence. Signs and symptoms will be flu-like with generalized pain. These are symptoms from the pre-icteric phase. Some patients won't have any at all. Infections have decreased 95%. Only 0.5% of people under 40 are infected per year. In 2016, there was less than 4,000 cases. The incubation period is from 2 to 6 weeks. The infectious period is 2 to 3 weeks before and 1 week after development of jaundice. The diagnostics include presence of hepatitis A virus antibodies and presence of immunoglobulins M and G antibodies. Other diagnostics include an increase in ALT, AST, and ALP levels, along with an increase of total bilirubin levels. All of these help detect liver damage. The best treatment for hepatitis A is rest and hydration. Rest is best determined by the patient depending on severity. Recovery happens within 3 to 6 months of the onset. There are no antiviral treatments for hepatitis A. The best way to prevent infection is by getting vaccinated. There are 2 doses 6 to 18 months apart. Children aged 1 and older should receive it. The immunoglobulin is given for passive immunity either before or after acute exposure. The best way to prevent hepatitis A virus is by being clean, living in sanitary conditions, and receiving the vaccine. If you are infected, rest, drink lots of fluids, have a balanced diet. It may take several weeks or even months to recover, but remember it is not chronic.
Hepatitis B is a viral DNA infection transmitted in blood and bodily fluids, mainly via IV drug use, sexual intercourse, and childbirth exposure. It can also be passed during blood transfusion and hemodialysis, and through the sharing of razors and toothbrushes. Its ability to establish an infection is enhanced by a long incubation period, high viral load, small minimum infective dose, and empty antigen decoys. Hepatocytes continually release virions by exocytosis rather than dying after cell lysis. Perinatal exposure is the most common route of transmission in locations with a high incidence of hepatitis B. Babies born to mothers who are hepatitis B antigen positive should receive hepatitis B immune globulin to prevent infection after childbirth contact with body fluids. Newborns have a much higher risk of long-term health problems if infected with hepatitis B. Vaccination provides lifetime immunity and wider public health protection. The elderly are at a higher risk of fulminant hepatic failure, liver abscesses, and cirrhosis due to impaired immune function. Late life diagnosis of a 20 to 40-year asymptomatic hepatitis infection often reveals severe tissue damage. Prevention of hepatitis B by active immunity occurs when IgG hepatitis B antibodies form during childhood immunization, lasting a lifetime in 95% of the population after a series of 3 injections. My daughter Zoe celebrated her final round just last month. Due to the hardiness of hepatitis B outside of the body, exposure risk reduction is crucial. In cases of accidental needle stick, mucous membrane splash, known sexual contact, or perinatal exposure, hepatitis B immune globulin from human plasma bolsters antibody response. Medications for active infection include alpha interferon, an endogenous protein that boosts B cell production and activates natural killer cells, as well as Epivir and Hepcera, which prevent viral replication. Malignant liver cells have been found to express hepatitis B virus antigens and genome, and hepatitis B carriers are 200 times more likely to develop liver cancer. This link could be due to the unique DNA structure of hepatitis B. Hepatitis D, named for its delta antigen, is a co-infection that requires active hepatitis B to successfully replicate. As they work together against the immune system, there is a greater likelihood of carrier state, chronic infection, and cirrhosis.